Okay, thank you so much to the panel. I think this was very, very informative. So now you guys, you're all here because you're interested somehow in global health and on making an impact, but you don't have to wait until you have a fantastic career. There are things that you can do as a student, okay? And you're making a first step just by being here. So up next, we're going to have 4 talks from students who are making an impact in global health their own way, okay? So doing a variety of different things. And first up, I would like to introduce Nathan Lowe. So Nathan is joining us today from Stanford University, where he's currently a medical student. He is also an alum of Rice University, as well as a Baker Institute intern, where he worked as an undergrad with Dr. Matthews and Dr. Lane. So please join me in welcoming Nathan, who's going to tell us how he's making a difference by doing research. So welcome, Nathan.
Thank you for that introduction. I can get this. So today, I want to make the argument for why students are uniquely positioned to make meaningful contributions to research in neglected tropical diseases. And to do this, I'm going to speak about one of my own experiences in research and why I think that my role as a student gave me the unique skill set to make a difference. And I'm also going to tell you about lessons that I've learned along the way. Now, 4 years ago, I sat in this exact room listening to a lecture by Dr. Peter Hotez, who talked about why we should care about these neglected tropical diseases. And he opened with the phrase that these are the most common diseases that you've never heard of. And I thought to myself, he was right, I hadn't heard of any of these diseases. And he went on to list a series of these, schistosomiasis, leishmaniasis, ascariasis, and chuckled that most of the audience probably couldn't repeat the names that he just said. And I thought to myself, yes, I couldn't, and he was right again. And he made a lot of compelling points about why we should care about these NTDs. And this kind of planted the seed for my interest in working on this topic. But it wasn't the next day that I got involved in this research. It wasn't until I went to medical school 2 years later that I had a fresh start, an interest in research, and thought maybe now is my time to get involved. So I didn't really know where to get started. It was very intimidating. I didn't know what skills were needed, what the important questions were. So like many people, I started on trusty Google. And I started going around trying to read articles and learn as much as I could. And eventually I found myself on the World Health Organization website. And I found this booklet. And this booklet talks about how the world approaches treatment for the helminth, or the worm infections. And there are 2 major sets of worm infections that they talk about. There's schistosomiasis and the soil-transmitted helminths, which are the big 3, the roundworm, the whipworm, and the hookworm. And it talked about how we use mass drug administration to treat these diseases. And basically, mass drug administration is when health workers will go to a school and they'll hand out medicine to all the children. And this makes sense because such a high proportion of children are infected. The medicines are often donated, meaning they're very cheap, and they're quite safe, meaning there's very few side effects. So it makes sense to just give out this medicine. But the more I learned, the more I realized that the focus was really on children. And I started to wonder that while that's nice, surely other people were infected, adults, and younger children. And if we only treated children, wouldn't they just go home to parents who were infected, go back to school with teachers who were infected, and walk around in communities where their neighbors were infected? So why not treat the entire community? So that's what I wanted to know. But I assumed that a lot of smart people, far more experienced, far more intelligent than myself, had designed these guidelines and designed this approach to focus on children. But, which brings me to my first lesson, that I think the naive optimism that we have as students, striving for what should be rather than what is one of our greatest strengths as students, and something that should be viewed as that, a strength, not a weakness. So I went forward with this idea that maybe we should treat the entire community, and I started reading more, asking professors. I even emailed the World Health Organization from my Gmail account. They didn't respond, but I wanted to know why we didn't treat the entire community. And eventually, I came to the conclusion that it was based upon expert opinion, meaning a lot of smart people did decide these guidelines, but they weren't necessarily supported by rigorous studies. So I decided that I would take this on as a research project. But once again, I didn't really know where to start. There weren't actually any faculty at my university who worked on this. But eventually I found a professor who was willing to give me a shot. He wasn't even at Stanford at the time, but he'd been recruited, and he told me he would work with me. And while he said he liked the idea, he asked if I knew what it would take to rigorously evaluate this question. And I said, no, I really did not. But he did his best to explain. He said we'd have to model the way diseases were transmitted through mathematical models that would simulate people and disease spread. We might have to look at the costs of different strategies and compare them, and compare that with the benefit. And the more he talked in granular detail, I realized that what it would take would be computer programming, basic mathematics, and other modeling techniques. And I realized that these were actually classes that I had taken in college, and these were actually skills I had. And these are the course offerings at Rice, where I was an undergrad. And these were classes that at the time I thought were completely irrelevant to my future in medicine. And some of them I liked, and some of them I really didn't. But regardless, I had gained these skills, and I realized that I could hit the ground running on this project. And of course, there were gaps in my knowledge. Cost effectiveness studies I didn't know, so I enrolled in a class later that afternoon in the business school. And transmission models, how to actually parameterize them, I didn't know. So I went to the library, checked out these 2 books, and for the next week spent my time reading them. And it's very unique that we have this opportunity, these educational opportunities at our fingertips, whether enrolling in a class that's incredibly relevant to our present pursuits, or having the time to go to the library and read these books. And so not only is it important to use our student resources, but always do best at any stage of our education. These skills in programming and math as a medical student, I didn't ever think I would use them. And right now, they're perhaps some of my most marketable skill sets. So to show you a little bit about my study, I'll first show you results from the transmission model. And what this is its prevalence on the y-axis, so proportion of people who are infected, and the x-axis is a 15-year time horizon. And you see these 3 lines correspond with different age groups. So we have black is adults, blue is SAC or school-age children, and red is preschool-age children. And what this is it's simulating an annual treatment program. So you notice that the blue line, or children, goes up and down and up and down. That's basically showing once-a-year treatment that brings down prevalence, and then over the year there's reinfection. But what you notice is when you only treat children, which is what's currently recommended by the World Health Organization, even if you do so at a high coverage rate, and this coverage rate is far greater than what's typically expected around the world today, you don't actually decrease prevalence. And it isn't until you expand treatment to the entire community that you'll really drive down prevalence. You'll really drive down burden of disease. Now, it's important to realize that we need to stay focused on what our true goal is in research. It's not really to publish a paper or to work on these topics. It's really to take the knowledge that we gain and apply it in the correct context. Sometimes that means trying to change human behavior. Sometimes that means trying to change the way healthcare is delivered. In this case, it's trying to change policy. Because in this case, the way these helminth or worm infections are treated are based upon the World Health Organization guidelines. It's based upon the policy they set. So that was the goal that we set for our study. Now we realized because we were trying to change policy, more mathematically derived arguments might not be as compelling as a more common language, such as finances or health economics. So we did that analysis as well. So this is results from the cost effectiveness analysis, showing that treatment of the entire community compared to only treatment of children was highly cost effective. Specifically, it would cost $167 to save 1 year of life. And to conceptualize that number, in developing countries, if this number is below $1,000 to $2,000, it's considered highly cost effective. For even broader context, in the United States, we often spend up to $50,000 to $150,000 to save this 1 year of life. So $167 to save 1 year of life by expanding treatment to the entire community is highly cost effective. Now, the next step, of course, is to go through with the publication process, because we want policy to be supported by rigorously evaluated studies. So we were fortunate enough to publish in the Lancet Global Health, but going back to this goal of trying to change policy, we wrote the paper from the perspective of being compelling to policymakers. So our results highlight the health economics argument, And in the very first paragraph, we specifically say, these results mean that we need to re-examine global guidelines and perhaps modify them to reflect evidence. Now, in my mind, a publication is useless unless the knowledge gained is applied correctly. And so we wanted to make sure that the relevant parties, the nonprofits, policymakers, the World Health Organization, heard about these results. So we pushed forward and got the press release. We were lucky enough to be picked up by the BBC and even relevant parties on Twitter, trying to reach the people who would be able to apply this knowledge correctly. And just for safe measure, this is my email to the World Health Organization minutes after the paper was released online. And I can't tell you how the story ends, because a goal as ambitious as policy change doesn't happen overnight, which brings me to my final lesson of don't stop pushing towards positive change. It's the stubborn, optimistic spirit of students and the access to resources we have at our fingertips that will allow us to make a difference. And I hope this has illustrated how NTDs is a field where basic questions such as, should we treat the entire community, remain unanswered. And this is a way that you can position yourself uniquely to make a difference. I'd like to thank my collaborators and my funding source and the Baker Institute for giving me this opportunity to talk. Thank you.
Time for one or two questions. If anyone has a question for Nathan. Are there any questions in the audience? No? Oh, yeah.
Oh.
Up there.
This is just about the work that you did. Did you look at co-infection? Because human infection occurs with in that population there many other diseases that are there. So
Yes, great question. So the question was about co-infection with other diseases. So in the model, we specifically looked at 4 helminth infections with under 5 species. So schistosomiasis, the whipworm, the hookworm, and the roundworm. And the model included transmission and health economics information for all 4. In the future, because Mass Drug Administration also incorporates other worm infections and also malaria, we want to expand the model to also show that, because one of the things we found is that often, even though these diseases are co-endemic, like you mentioned, Mass Drug Administration programs will treat them separately. And what you notice is that the majority of the cost isn't the drugs themselves. It's getting there, it's the supply chain, it's the distribution process. So it makes sense that when these diseases are co-endemic, that you just pile on all these programs together. And sure, there are complexities with side effects that need to be worked out in certain settings, but especially for the helminths, it really makes sense to treat schistosomiasis and the helminths together. And that was really one of the major points that we're trying to drive in terms of changing World Health Organization policy and also making arguments about that from a cost-effectiveness standpoint. Yes.
Your med school have a research track? I mean, how do you work your research in with the other things you do?
Yes. At Stanford, we are required to do a scholarly project. It's interpreted very broadly. People do anything from like films to research to working at startups. But there is funding for that. There is time allocated for that. I'm currently taking a break between my preclinical and clinical education to do a year of dedicated research, and I am funded for that. And if I hadn't received fellowship funding, the med school would have paid for my entire year as well. For different schools, I think it does matter a little bit in your preclinical. Stanford really designed their curriculum to give time for research, and that was nice. But at other places, sometimes with grades and with other kind of incentives, it's harder to do that. So.
Thank you.
Thank you.
Okay, and I should also mention that Nathan is very involved with N7, the organization that Emily told you about in the beginning. And that's a great transition to introducing our next speaker, who actually started the first student chapter of N7 at Rice University. So she's also an intern at the Baker Institute, and she is one of the first place winners of our recent essay competition. So when you walked in, you may have grabbed a compilation packet, and her essay is one of those in there. Please join me in welcoming Anjali Bala.
Good afternoon, everyone. I wanted to first thank Dr. Jennifer Herricks and Emily Conron for giving me the opportunity to speak at this conference. And I'm going to be talking about how we can de-neglect neglected tropical diseases through advocacy. As an undergrad, when I first came to Rice, I knew that I was interested in health policy, and I knew that as a future physician that I wanted to have impact on healthcare delivery and the healthcare system. But as most undergrads, getting involved in policy seemed like a very elusive task to me. I had no idea how to get involved and what policy or advocacy actually entailed. So one day, through random chance, I happened to meet Dr. Jennifer Herricks, and she was looking for an intern. And she asked me, she was like, so what are you interested in? And I was like, well, I'm interested in health policy. And she's like, do you have any experience? And I was like, honestly, no. I don't actually know anything right now, but I can guarantee you that I'm a fast learner and I will be very useful to you. And she was like, I like your confidence. I'll get back to you. So I waited for a day or two, and she finally did get back to me, and I was hired. So working with Dr. Herricks, I learned about neglected tropical diseases. And through this, I learned about N7. So N7 is an organization that tries to raise awareness and funds for the 7 most common neglected tropical diseases. Through this, I started an N7 chapter at Rice so that I could teach other undergraduates and involve the undergraduate community in getting involved in neglected tropical diseases. So last semester, I actually had the opportunity to travel to DC. And I was sitting in a conference room, and I stood up because the Global Health Policy Director for Senator Lindsey Graham had walked into the room. I was actually in DC because I was advocating for increased funding for USAID's NTD Mass Drug Administration program. I was really nervous. I had never even talked to a representative before. I'd never talked to a staffer before. The room was huge, and I didn't know exactly what I should say. So I was talking to him, and I was incredibly surprised by the receptiveness that these staffers and representatives show. He was on board. He understood the importance of neglected tropical diseases. And at the end of the meeting, he had promised that he was going to do what he could to get more funding for NTDs. After that day, I realized how important it is for students and undergraduates and active citizens in general to get involved in the policy process. And some of my experiences are what I want to talk about today. So I want to talk about the importance of political action and how NTDs fit into that, and some of the successes that NTDs have already had in the past decade. And then I want to end with how you can get involved in NTD policy and advocacy. I often get asked what exactly advocacy entails. So advocacy is a really good way of protecting vulnerable and marginalized populations, advocating on behalf of population and global health, and giving expert opinion on legislation. Advocacy is important because you're important. The United States is a democratic institution, and part of the framework of democracy is going and advocating for issues that you find important. We've elected representatives, and part of their job is to act on what is important for their constituents. And because of this, as an active citizen and informed member of the United States, it's important for us to talk about NTDs and why they're important to our representatives. So why do NTDs specifically need advocacy? And so this goes back to the concept that Nathan previously described. NTDs are the most important diseases that you've never heard of. NTDs affect 1 out of every 7 people. They affect the bottom billion of the world's population. They're disabling, they're disfiguring, and they're debilitating. They have high morbidity, they're socially stigmatizing, and they contribute to the cycle of poverty. Because NTDs are considered diseases of poverty, those that are affected do not have a vocal constituency that can advocate for themselves. And that's why it's of utmost importance for us as undergraduates to advocate on behalf of those of people who get infected. So a question that I often get asked is, how much difference can I actually make? Does one person really have any say? And isn't the government just inefficient and bureaucratic and have a political agenda anyways? And so while that might be true to a certain extent, I've been pleasantly surprised to realize that we can actually make quite a significant difference. So some of the successes in NTD advocacy that have already occurred include increasing USAID NTD funding. This graph shows how just from 2006 to 2014, we've been able to increase funding for mass drug administrations from $15 million a year to $100 million per year. That is a huge increase in funding, and it's had a huge impact in making sure that treatments have been able to be dispensed and that NTDs have been able to be on the global map. Another success that we've had in the past decade is this concept of vaccine diplomacy that Dr. Peter Hotez actually came up with. So the concept of vaccine diplomacy is cooperation and educational collaboration between two different countries in which they exchange scientific information and also build a relationship. And so NTDs fit into this framework very nicely because there are countries that are endemic but don't necessarily have the resources to put all of the money that's necessary in order to build these therapies, and the US has the money and the resources and some of the scientific technology as well as the foreign policy drive to do this. And over the past 10 years, we've seen some effective therapies that have come out of this concept of vaccine diplomacy. The third, which is huge, is the inclusion of NTDs in the Sustainable Development Goals. So in the year 2000, the Millennial Development Goals were negotiated, and unfortunately, NTDs were overshadowed by what's considered the big three diseases in global health, which are HIV, AIDS, TB, and malaria. NTDs were basically reduced to other diseases. However, actually just this weekend, the Sustainable Development Goals were renegotiated, and NTDs have been included in Goal 3, and this is a huge step forward, and this happened on part because of N7 advocacy and nationwide student advocacy, and this really puts NTDs on the global map. But why NTDs specifically? So one of the most important reasons why NTD advocacy is so important is because it's really a global health Best Buy. For every $1 that we put into NTD programming, we leverage $26 worth of investment. So that's huge. And this really goes in collaboration with this concept of effective altruism, which is not just using your head which is not just using your heart when deciding what causes are important, but also your head. And so this is not only an issue that's of incredible importance, but it's also one that's incredibly effective and can make a huge impact worldwide. There are a few ways to kind of achieve political visibility for an issue, and so the first is credible evidence that it's even an issue. And so NTDs, this evidence has already been proven, it exists, and once you have that, the second is actually having global champions for this issue. And so there are scientists and major public figures that have put NTDs on the map as an important issue. And once you have those people who can be global champions, from there, what we really need is political institutions that can advocate successfully to promote this issue. And right now, NTDs, there are some institutions that do advocate, but this is still an unmet need. And it's something that we definitely need more of, which is why, as students, we can have a huge voice in this issue. So as a student, one of the best ways to get involved is to join an N7 chapter. So one of the reasons why I started an N7 chapter at Rice is because not only does it help to build public awareness and fundraise for mass drug administration programs for US aid, but it also helps educate students at a very young age on the importance of this issue. And in Houston, NTDs are actually they exist. So there's an NTD clinic in the medical center, and when I've talked to students, I've been able to get them interested. Some people are starting to participate in research, and through kind of this N7 chapter, we've alerted the student body that this is a problem. Students often ask me how they can participate in NTD advocacy. And of course, I tell them to join an N7 chapter. One of the unique things that our chapter of N7 has done at Rice is we've incorporated a policy and advocacy committee into our programming. And so the idea is that we are trying to drive students to write letters to their representatives, to call their representatives, to write petitions. And on the bottom picture on the slide actually shows a petition that we did last week in which we collected over 150 student signatures for the inclusion of NTDs in the Sustainable Development Goals. And just this little act of pressing a send button on a pre-written essay and having kids sign actually really builds their commitment, and this is how conversations start. The picture on the left shows a picture of me along with the 2 vice presidents of N7 when we traveled to DC last semester to advocate on behalf of NTDs. And so one of the questions that I get is, when you go to DC, how do you even talk to representatives? Like, what do you say to them? Why do they care what you have to say? But they actually care a lot. And so to kind of show you how you can talk to representatives, I'm actually going to invite Cyrus on stage, who went to DC with me, and we're going to reenact a conversation between a staffer as well as a student. So thank you. Here, maybe we should...
Hi, I'm Cyrus, staffer for Senator Ghaznavi. Nice to meet you.
Hi, my name is Anjali, and I'm president of N7 at Rice University. It's a organization that tries to build public awareness and funds for neglected tropical diseases. And I wanted to talk to you about USAID's Neglected Tropical Disease Program today.
Okay, well, before we jump into the budget, could you tell me what an NTD is exactly?
Yes, of course. So NTDs actually affect the bottom billion of the world's population. Okay. They're called diseases of poverty because they affect those in developing countries for the most part. They're debilitating, disfiguring, and they're socially stigmatizing, and they contribute to the cycle of poverty. And this is one of the reasons why this is a really important global health issue that hasn't been addressed.
Okay, so tell me what you would like us to do for you.
Yes, so the US has really been a world leader in tackling NTDs. So USAID has an NTD program where they go to 25 different countries and they dispense drugs that have been donated by pharmaceutical companies of the US, and for 50 cents you can prevent one child from having 7 of the 7 most common NTDs for an entire year. And for every $1 you put into that program, you get $26 of treatments out of it. And unfortunately, when we were looking at this budget for this year, the funding was cut by $13.5 million. We wanted to talk to you about increasing the value back to $100 million as it previously was.
So you're telling me that for 2 quarters, we can get all 7 treated and cured?
Yes, so it prevents them from having these diseases for 1 year, and it's been shown to decrease the prevalence of these diseases in endemic areas. Okay. And so since the USAID NTD program has started, they've dispensed over 1 billion drugs dosages, over 475 million people have been affected, and it's had a great amount of positive impact, and it's really a global health Best Buy.
Okay, wow, that sounds like such an amazing program, and I'd hate for you guys to lose your momentum and all of the empirical success that you guys have had, so I'll let Senator Ghaznavi know that we should definitely put our support behind this. But in the meantime, is there anything that we can do to help before that budget negotiation starts?
Yes, so there's actually an NTD caucus. So if Senator Ghaznavi is on board, we would really appreciate it if he would join this caucus where people who have support for NTDs and NTD fundings and programs for effective therapies can discuss and join, and then we will be in contact with them.
Fantastic. I'll tell them at our next meeting.
Thank you.
Thank you for visiting us.
Appreciate it. So which 1,500 students last year actually signed a petition to increase the funding, and we actually succeeded. And so if 1,500 students can accomplish this, what could we accomplish if all of you also joined? So thank you.
Are there any questions for Anjali before she goes down? Okay. Yeah, Dr. Lane.
I have a question. So was it your impression in talking with congressmen and maybe staff that they didn't know anything about NTD before you told them?
So that's a really good question. I think the senators who are invested in global health issues do normally have some amount of knowledge, but there are also a lot that don't. And one of the biggest advantages of NTD advocacy is that global health is really a bipartisan issue, and so if you kind of increase awareness of the problem, you can accomplish a lot.
Yeah, that was really my point. I mean, they're small staff, they deal with enormous number of complicated issues, and often they really don't have time to know. And so you coming in is a real opportunity, as you've already outlined.
So what events do you guys have planned for the upcoming year?
That is a great question. So we are actually going to be having a blog where we're going to be having students write about either their experiences with NTDs when they traveled abroad, or we're going to be also outlining patient stories where we're going to be interviewing patients that have had NTDs and they can tell us about their experiences. We're also doing things like these petition drives. So one of our major policy goals for this upcoming year is to kind of implement this global health indicator for neglected tropical diseases so we can track the progress that's being made. And so we're going to be having a petition drive for that soon. And then we're hoping to make this traveling to DC and advocating for increased NTD funding a yearly thing. So it's our first year and we're getting our holding, but it's going really well.
Thank you.
Thank you.
Okay, so we have 2 more talks, and next I would like to introduce Jennifer and Emmy, who actually come to us from Canada as winners of the second part of our student competition. So we asked students to give us a concept for how would you do children's outreach? How would you teach children about NTDs? And we got so many great entries. Graphic novels, board games, books, and in the end, we had to pick one, and we went with Jennifer and Emmy that I'm going to let actually them tell you about their concept. It ended up being more educational, and we really liked that, and so we want them to come up and talk to you about education and why education and outreach is so important and how you can have an impact in global health if education is your passion. So Jennifer and Emmy, please welcome me in and join me in welcoming Jennifer and Emmy.
Hi, I'm Jennifer Nguyen.
And I'm Emmy's son.
So today we wanted to start by asking everyone a few questions. So when did you start learning about NTDs? Was it maybe in high school or university? Or was it even maybe later on in life? Also, was it difficult finding resources initially? Emmy and I definitely found it hard in the beginning. We noticed that beyond academia and college-level courses, there weren't enough opportunities for youth to be engaged in NTDs. Also, for resources on NTDs, we noticed that they were mainly geared towards students who were in the biomedical field, which left a lot of students who were from different disciplines out of this conversation. So to address these issues, we think that there's a real need for more educational resources on NTDs that are accessible to youth who are going to make up our next generation of NTD advocates.
So I first heard about NTDs from UAEM, Universities Allied for Essential Medicines, a student-led organization that aims to promote innovative research and equitable access to health care, or to medicines, And it was shocking to realize that until university, I was unaware of something that is so globally present. So when I tried to learn more about it, I found it very difficult because resources on NTDs were so fragmented. So I looked within my school and I found a parasitology course, but it was only offered to third-year science students despite the multidisciplinary nature of NTDs. And had I been in another program such as economics or political science, then it would have been even more difficult to learn about the issue. And I'm sure these are challenges that many other students face as well. It's just that having the majority of the discussion on NTDs happen at higher levels of academia really created a barrier for youth like me to learn more about the issue.
So I had a similar experience to Emmy when I first learned about NTDs. And when I was talking with my peers about NTDs, I found that I was often very frustrated because people tend to brush these diseases aside, thinking that these don't affect us as North Americans or that these are isolated issues for others that don't actually affect us that much. But actually, 1 out of 6 worldwide are impacted by NTDs. And these diseases are often chronic, and when left untreated, these can be very debilitating on a daily basis. And NTDs can often be seen as unglorious diseases, though, since they're chronic and they don't cause sudden death. So this attracts less sensational media attention, and often that means that we don't think they directly impact us.
But are NTDs limited to the tropics as their name implies? What is the scope of the issue? Okay, currently, more than 12 million Americans are affected by at least one NTD. And this is only the number of reported cases. There really isn't enough epidemiological data collection to know for sure the extent of the burden that NTD has on America. For Chagas disease alone, most of the cases were detected not through patient diagnosis, but through blood screening from blood donors, which is just a fraction of the population. Researchers at Baylor College of Medicine found that 1 out of 6,500 blood donors from Texas had tested positive for the Chagas parasite. Now, with this being more than 46 times higher than the CDC's national estimate, Chagas disease, or the scope of Chagas disease, has been severely underestimated. And this is only one out of many NTDs.
Many NTD contractions often go undetected, especially since some of them remain silent in the host for long periods of time, while others actually have ubiquitous symptoms. For example, dengue fever could be misdiagnosed as the flu. Toxoplasmosis or Lyme disease could be misdiagnosed as depression. But for many NTDs, such as Chagas disease, early detection and treatment are key to having a higher chance of recovery. So raising awareness of NTDs is one of the first steps towards addressing this issue and finding a more accurate estimate of the global burden of NTDs. According to the WHO, 1.6 billion are at direct risk of contracting at least one NTD. And on top of that, 1.4 billion have already contracted at least one NTD. And with climate change and global warming, this number is steadily growing as the range of vector-borne NTDs spreads.
So evidently, NTDs are not just limited to the tropics, but are affecting North America as well. And it is crucial that we address this issue, and it doesn't have to start from university. In this case, early education and awareness has a twofold effect. First, it empowers youth to take the preventative measures and alleviate potential burdens in their lives. And second, it may spark an interest amongst children and influence their careers.
So for our entry into the Baker Institute's NTD Challenge, we created an educational interactive activity that's geared towards 6th grade children. We chose 6th grade children since this is the earliest age that children have the cognitive development to both understand the information and retain its significance. And through role play, we wanted to also teach children about the human connection to NTDs and about how some social determinants could affect their transmission. We also felt that educating through interactive role play would help give these children the motivation to internalize lessons on NTDs in a fun and memorable way.
So for this activity, we chose to focus on 4 NTDs that are most prevalent in the southern United States. And here's how our activity works. So the class is divided into 2 groups, a patient group and a doctor group. Each patient gets a patient profile with information such as their personal story, their symptoms, and risk factors from daily lives. And there will be a total of 4 different patient profiles. Each doctor group gets a master package of information on all 4 NTDs with information on their symptoms, risk factors, and potential treatments. And so they use this information to diagnose their patients, talk about some preventative measures that they can take, and also prescribe treatments.
So our solution is just one of many potential solutions that could help raise awareness of neglected diseases to younger children. But with this said, effective education is continuous. And the next step would be to continue engaging children to continue learning about NTDs through student-led organizations such as N7 and Universities Allied for Essential Medicines, or UAEM, as well as through student initiatives such as the NTD Challenge that was hosted by the Baker Institute. UAEM, for example, is currently developing a collaborative online project, and collaborative projects between students and NTD researchers and professors are also a great way to engage youth in learning more about NTDs. With UAEM's collaborative online platform, it uses a case-based learning approach in order to foster more collaboration between NTD researchers and youth. And it also encourages youth to think about NTDs beyond just the microbiological perspective, thinking about the biology of these diseases and also how climate change and socioeconomic and political factors could affect these diseases. Currently, online resources on NTDs are quite fragmented, which makes it difficult for the average person to access and engage in this conversation. So with these collaborative projects, there's more engagement and communication that's encouraged amongst NTD researchers and youth, which is especially important to foster more interest in NTDs amongst youth who live in NTD endemic areas. These collaborative projects would also encourage addressing NTDs to be more inviting towards multisectoral voices and solutions.
So why should we hear about such a prevalent global issue when we're in college? Despite being in college, why is there still a lack of resources to learn about NTDs? According to the 2015 UAEM report card on global equity and biomedical research, only 1.5% of total PubMed publications from the top 59 North American universities had a neglected disease focus. So we need more researchers and we need more mentors. But if you think about it, it's a cycle. Interested youth are motivated to be involved and become the next mentors. So how will we have mentors if there's a lack of initial youth involvement? And this is where we think NTD education comes in. It starts the cycle. With our uncharted careers emerging, today's generation of youth will make up the next chapter of our society. Let's work towards one that is educated and aware of neglected tropical diseases. Thanks.
Thank you.
Thanks, guys. Are there any questions? Yes.
The World Health Organization has 5 of the 17 diseases on a track for control or elimination, but in the next 6 years. How would you encourage youth to get involved in that particular piece of the NTD equation? Because you're talking about a cycle that is a long cycle. And here's a great opportunity for your generation to leave its legacy before you're even out in the workforce. What would be your advice to your friends and colleagues?
I think actually getting more involved in NGOs is a really good way to start because I actually attended the WHA this past May and it was a really good opportunity. There was a lot of youth engagement there and I had the opportunity to meet with the Canadian delegation and discuss NTDs, which is really good because we could raise awareness about how they're becoming more relevant to North America, especially to and they were very receptive towards what opinions of youth were, so I think that's one way to start.
Yeah, one more question.
Okay, my question is, the talk is relatively long. I think perhaps it would be a little brief. I really want to know how to describe NTDs in 2 or 3 words, 3 sentences is enough. So why not tell me something about the NTDs in no more than 3 sentences? Thank you.
3 words or 3 sentences?
Yeah, I think perhaps this.
No, 3 sentences.
I would say world
It's about education. Yeah.
Right.
Yeah. 2 or 3 sentences is enough, I think.
If you were to put NTDs, or do you want to answer? If you were to describe NTDs in 3 words, I would say that's the world's bottom billions disease. But in 3 sentences, I would say neglected tropical diseases are diseases that tend to affect the poor, but then there's also a lot of other things that could affect the transmission, depends on where you live, and there's socioeconomic determinants, there's all these different things. So it's difficult to decide on 3 sentences on the spot.
I will say if you Google N7 Student Communication Guide, we have a great resource that answers that question and has 3 of what we call our elevator pitches. So depending on how long you want to talk, there's a really short one, there's a medium one, there's a long one. Although I think your answer is great.
Yeah, I think that's one of the challenges too, is that it's such a complex issue that it's really hard to put it into a soundbite, right? Which has been one of the advocacy challenges that we've had. So thank you, Jennifer and Emmy.
Thank you.
Okay, so we've heard about research, we've heard about advocacy, and we've heard about outreach and education. So next, I would like to introduce you to Tassine, who's a medical student at UT Health, just across the street. And he has been looking for a way to make a difference, without interfering with his extremely busy schedule. And I think that that's something that we can all relate to, right? And so he actually... he's going to come and talk to you about resource mobilization, which is something that he found he could fit into his very busy schedule, and he made a huge impact raising money for N7. And so, Tassine, I want to invite you to come and tell you about that experience. So welcome.
Thank you for that intro. I think if I learned anything today, I should take a public speaking class, because those guys did so great. I got my papers in front of me, so hopefully it goes smoothly. So I just want to talk a little bit about my experience with the N7 and how it started and how it ended. Hopefully it's going to continue in the future after my board exams. So I had my first experience with global health interning at ICDDRB in Bangladesh, which stands for International Center for Diarrheal Disease Research in Bangladesh. And so each year, hundreds of thousands of patients go through the center suffering from diarrheal diseases such as cholera and shigellosis. They come in dehydrated and just terribly sick, sunken eyes, and malnourished, just all the symptoms that you would fully expect with patients suffering from communicable diseases like cholera and shigellosis. So this is Shakila, and you can see she's severely malnourished. She's actually 11 months old in this picture, and so by now I think she is 4, so this was 3 years ago. And when she was admitted to the hospital, at almost 1 year, she was only 8 pounds. So, I knew malnutrition could be caused by congenital syndromes or enzymatic deficiencies and things like that, but I also knew it could be due to neglect by the parents. And so Shakila came in with her mother, and I actually harshly judged her mother for letting this happen to her child, letting her child starve and become malnourished to this extent. And but after having a conversation with her in the broken Bengali that I can actually speak, I found out that she was suffering from severe depression, and that the situation was a little more complex than I previously thought. It wasn't ignorance or negligence. She was just physically incapable of taking care of her daughter, her newborn daughter. So 11 months went by, and then Shakila started to suffer from dysentery. And that's when Shakila's mother thought it was time that she needed to seek help. And so she came to ICDDRB, where I was doing my internship. And so my time in Bangladesh taught me a lot about disease. I got to shadow physicians and learn a lot about these new diseases that I had never really encountered. But it also taught me that people should never be defined by the disease. I always kept in mind from that moment on that behind every disease is a story and is a person with, and they're not truly defined by their condition. So as a public health minor at UT Austin, kind of coming more closer to present day, I gained more knowledge on diseases in developing countries. And I was appalled by how little I actually knew about how the extent of the disease in children around my age were suffering, and that didn't even make it to adulthood. So I joined several clubs, and I made it my duty to raise awareness and promote action on campus at UT Austin. And so I graduated from UT Austin in 2014, and I arrived at medical school here at UT Houston across the street. And I decided I wanted to continue to contribute to global health, to improving global health. But I soon realized that every day became kind of like cramming for finals in undergrad. Studying for med school was a little bit different of a ball game. And so I tossed the idea of devoting my time to service out the window, and I became immersed in flashcards and pools of coffee, and it was a different experience. But an opportunity came my way early on, first year. I'm a second year now, so this was last year. And it was a position of service senator of our class. So I knew that I really wanted to pursue that role in my class, to take a lead. One of the responsibilities was to select a global health charity and lead initiative and raise money for that charity. It's a challenge that had been in place since 2007 by one of our faculty physicians. And I thought it was a really great cause and a really great goal. So I was elected service senator, and I was excited to start on this new project. And I thought it was a great way that myself and my classmates could, have fulfilling lives as first-year medical students that were just, delved in books all day. So after extensively researching online, like Nathan said, I started with Google, and N7 was actually mentioned by one of my classmates, or upperclassmen, and I went to Google to check it out, and I found all these great resources. The website is wonderful, and it had I saw the shocking videos and then the touching testimonials, but N7 really stood out to me because I could see the tangible outcomes of our benefits, of our funds. And so like everyone has said, every 50 cents raised could treat and prevent neglected tropical diseases for a child for 1 full year. And I also found out about the Student Advisory Board, which allowed students to really serve as global health proponents outside the context of just fundraising. And I knew N7 was the best choice for our class and the goal at hand. But one thing that really stood in the way was actually my class itself. How could I convince these hundreds of kids that, they're stressed and they're busy, and how is this really worth their time? So why should they devote valuable and crucial study time to just the benefits of some random nonprofit? So I wondered, why would they ask, what's the point? And I found out, that's actually it. What was the point? So I posed the question when I started to campaign for M7. I asked them, what was the point of coming to medical school? Why did we come here in the first place? And I answered for them. I said our real purpose was to. I didn't give them a chance. I told them that our real purpose was to apply the hard sciences that we're learning to help actual people out there in the world. One way to grasp medical students' attention is to put the pen and paper knowledge that we gain every day into and make it really very real. And so we all knew about elephantiasis and what drugs to treat, filariasis with, and the vaccines that exist, but we weren't aware of the extent of the morbidity and mortality and the true cases that are actually being affected by these diseases every day. And so, just like in the case of Shaquila, we know the disease in a very specific context, but our goal in medical school is to humanize it. And so I showed them the same videos that I watched, and showed them the same statistics, and we had open conversations about NTDs and ethics and medicine in that respect. And I urged them that, it wasn't enough to know, and that we had to act. And as medical students, as first-year medical students, we could truly make a difference and save lives by choosing N7 as our class charity to benefit for the year. And it was actually easier than I expected, because when I told them about throwing a Vegas casino-themed party, they really jumped on board quickly. So that's another key to getting people on your agenda, is to cater to theirs. And last year we took over 45 exams, and all of them were grueling and time-intensive. You just had to devote so much of your schedule to it. And so we don't have much time to enjoy ourselves beyond the library. So whenever we do, it better be good. So, this is a couple more pictures of the event. And while having a good time and supporting a great cause, we actually raised over $5,000, which is enough to treat 10,000 children for a year for NTDs. But I knew we could do better, so we raised our fundraising goals even higher. And we decided to have a silent auction later that spring. And so this is just an image of the silent auction place actually in our medical school building. With the help of persuasive classmates, that could easily have passed for used car salesmen, we reached out to over 100 Houston businesses for sponsorships and donations, just things that we could sell. And a lot of those patrons were actually classmates, parents, or friends. And so, again, connections are actually really important in fundraising. And in the end, through perseverance and sure will, we actually gathered over 30 items to sell, and we were able to get supporters to make generous bids on these things. This is actually an autographed poster by Clint Capella, if there's any Rockets fans out there. That went for quite a bit of money. And we raised $3,000 in all. And so we weren't afraid to ask some of the well-off medical professionals around us for placing some bids. So it really helped to have those medical professionals there because they're involved in healthcare, and they really care about our cause. So after some hefty donations and some incredibly generous faculty members, we raised over $15,000 for the year, and 100% of that will support NTD treatment programs in place by N7 and the Sabin Vaccine Institute for treatment programs in Africa, Asia, and Latin America. But more than that, through our fundraising efforts, we raised awareness of NTDs. And we found out that we can continue contributing to global health even through our 80 hours of studying a week. And just one thing I wanted you guys, any students out there that intend or really want to get involved with fundraising at an undergraduate level or any level at that, you remember you always have time for things you care about, and for me that happened to be serving others. And despite the high workload that you might have interacting and communicating with the venues and donors and the school administration, you can end up being completely proud of what you did in the end. And it's very fulfilling to be able to reflect on your commitments. And I'm incredibly proud of my class. We were able to help people who were not so different from ourselves, but definitely in much tougher circumstances. So throughout this fundraising initiative, I realized that emotionally appealing to an audience can truly bolster a cause. Initially, very few of my classmates were interested in participating in our class charity events. They would honestly rather read a textbook, but after showing them data and evidence of human suffering that's caused by NTDs, I really got them to listen. So a couple of things that you can actually do when you try to take on one of these initiatives is to tap into people's empathy and give them a clear way to give back and try to have fun doing it. Bottom line, fundraising is a powerful way to make change, and you might even realize that you yourself changes in the end. So thank you. If there's any questions? Yeah. Sure.
I'm just wondering, do you think fundraising is sustainable in the long run, or is there some other systemic change that's also necessary?
Definitely. I agree with all that's been said today about public policy making, and that's equally, if not more important than fundraising, just to, like you said, make an impact in the long run. But at our level, I'm assuming you're a student, so at our level, I think fundraising is just one of the easiest and most impactful ways to really make a difference. And as Jennifer was saying, I am busy just like everyone else in this room, and finding time here and there to gather a couple of dollars, it really makes a difference in the end.
Thank you, guys. Okay, so for the students out there, those in the audience here with us and those who are streaming live, I hope that hearing all the different things, the different ways that these students have contributed and how fulfilling it is to them, just to know that you can do it too. You can find a way to make an impact in your community, whether that is through NTDs or another issue that is close to your heart.